Dr. Siraj, representing Dr. Yunus Wadi Mariam from WHO Country Director, our CDC Country Director, Dr. Lisa Nelson, our UNCDF Country Lead, Chris Lukoyo, our IDI-ED, Dr. Andrew Kambugu, our Academy Board members, representatives from government ministries and agencies, all our speakers, presenters, and most importantly, all of our innovators who are here today. You're most welcome for our fourth Health Innovations Conference for Uganda. As we come out of the COVID pandemic and hopefully soon our Ebola situation, we are aware of the need for continuous innovation. And we hope over these next 2 days we can see how innovations can help us to make our health systems sustainable and resilient for the future. I would like to welcome all of our honoured guests and speakers, but a special welcome to all our delegates who have travelled. We have guests from all around Uganda, up from West Nile, from Kabale in the south, West Nile in the north. We have visitors from Kenya, Tanzania, from South Sudan, from Rwanda, and further outside the EU, to the East African Union, we have Malawi, Senegal, Sudan, and Somalia. You're all most welcome. We also have some international guests from the US, India, and the UK. We would especially like to welcome our new colleagues who are forming today part of the Hub for Artificial Intelligence in Maternal, Sexual and Reproductive Health, which is launching at IDI this week, so you're very welcome. Even though this conference has been branded a Ugandan conference, we have found over the years that young innovators from around the continent have made their way to this conference. And really this is testament to the creativity, the ingenuity, and the desire for knowledge and for activities in health innovations that we see in young people across the continent. We really hope over the next few days we can look to find solutions to help with our health problems. We have a really exciting program. We'll be covering topics such as artificial intelligence, bioinformatics, health workforce for innovation, new innovations, medical drones, and also the enabling environment, policies, regulations, and other areas which are important to enable health innovations to scale. It's so nice to be here in person. It's been a long time since we've managed to have this kind of engagement, and we really hope that delegates will take the opportunities over the next 2 days to cross-fertilize, to speak to each other, to generate new ideas, to share your creativity, and really look forward to improving health systems in Uganda and beyond. Just to say, we hope you enjoy yourselves over the next 2 days. We hope it will be fun and engaging, and thank you all for coming.
Excellency, Ambassador Natalie Brown, the CDC Country Director, Dr. Lisa Nelson, Dr. Suraj, who's representing the WHO Country Representative, Chris Lukoyo, who's the UNCDF Country Lead, all you senior delegates, and as we say in Uganda, all protocols observed. I think my colleague Rosalind did a good job recognizing the delegates in the room. Permit me to extend a very warm welcome to all of you to this exciting two-day meeting. And my invitation to you is to this meeting, but as we've heard, we have delegates who traveled from abroad. So a special welcome to you, and welcome to Uganda, welcome to Kampala. And I hope that outside the meeting, you'll have the opportunity to enjoy this beautiful country that is called the Pearl of Africa. Excellency, these past few days, I had the opportunity with one or two colleagues of mine to attend a meeting in Nairobi dedicated to climate change. The meeting is a private sector engagement that was highlighting the existential threat of climate change And one of the insights from the meeting is that whereas Africa contributes less than 3% to greenhouse gases, Africa is very likely to bear the brunt of climate change. The meeting was an encouragement to me because it was a private sector, African-led effort. And this is the 4th edition of the meeting, with this particular one focusing on climate change. It was encouraging because, as I said, it is an African-led effort, but also it is fostered and midwifed by an African institution, the Nation Media Group, which is a private sector initiative. One of the insights in this meeting is the potential for Africa to harness the young talent that we have, which is called the demographic dividend, to really bear on some of the critical challenges facing Africa. So as the director of the institute that is hosting this meeting, I'm really gratified looking at the audience and seeing the demographic of this meeting. I see many young delegates on the back seats. This meeting is for you because you represent the innovative future that Africa needs. And so, with that same thought about institutions, this past year, Makerere celebrated 100 years. And there are many of us here and abroad who have been nurtured by this great institution that is marking 100 years. Makerere has provided leadership, including in the space of research and innovations. We had hoped that we would be addressed by the Vice Chancellor of the university to really underscore the importance of this institution, not only in Uganda, but in the East African landscape. But it falls on me to make a few observations around institutions and Makerere's contributions. I think many of us know the multiple breakthroughs that Makerere has contributed, especially in the health sector. But also allow me to highlight one or two instances where the university has demonstrated innovation. Many of you know in the audience that Makerere has led the efforts to look for an electric vehicle, and there are efforts underway right now to look at expanding that work from sedan vehicles to buses and other public transportation. I think that is really a good seed that needs to be expanded. More recently, the leadership of the university convinced the government to provide a research and innovation fund. So I am pleased that even at this meeting we'll be joined by the leadership of the Makerere Research Innovations Fund. This is a fund which is competitive and at which young investigators with the best ideas are given seed funding so that the best ideas can see the light of day and possibly be scaled up. So in line with the current strategic theme for Makerere to be a research-led university, I want to congratulate the leadership of the Academy for fostering innovation. This meeting is in its 4th edition, and so you can see there's a commitment to create a platform where innovators can network and do very critical work. I also want to highlight the work of the Institute within Makerere, again through the lens of building credible institutions. The idea itself is an innovation in governance because it was believed that the traditional systems in the university were not agile enough to do some of the work that was required to address societal challenges, including HIV and AIDS. So the Institute was set up to address that challenge, and with the support of partners like the US government, through its agencies like the CDC, the IDI is a leading implementing partner, providing almost 25% of the case burden for HIV. And more recently, through that same support, supporting the Ministry of Health with emerging epidemics, including COVID-19 and more recently, Ebola. One of the things we have committed to in our strategic plan is to also harness data science because we believe it's really an emerging tool that might even possibly change the scientific paradigm. So as we convene this morning to talk about and reflect on resilient health systems, we are really gratified, Excellency, and all our senior delegates, that you found time to come and join us in this very important conversation. We believe that as part of the university, it's our duty to contribute to thought leadership and eventually to products and intellectual property that will benefit our society. I saw that in today's leading daily, there was an article by Your Excellency about human rights, and health is a right, and we really need to do whatever we can to make sure that our communities are well. So with those few remarks, I want to congratulate all of us for convening here, and I look forward to a very vibrant discussion over the next 2 days. I wish you fruitful deliberations, and for our delegates who've traveled to say, as we say in Uganda, karibu, which means welcome. Thank you so much for your attention, and God bless.
Thank you, Dr. Andrew. Good morning, colleagues. It's a pleasure to be here. And in fact, I'm going to reserve some of my time for our ambassador, and also I'll be on the panel later this morning. Ambassador, thank you for joining us. Colleagues from WHO, from Ministry of Health, I think they're around, UNCDF, of course the IDI team, and the visitors from places across the continent and across the world. And indeed, it's a pleasure to be here this morning. I think so much has happened in the last 3 years with COVID, some of it very painful, but I think some of the silver lining is we're thinking about health, global development, and how we work together in partnership in very new ways. And that is really a very exciting thing. Working here in Uganda, where there's so much innovation, so many talented health professionals, and so many young people, I think it's really a great place to have this institute and to have this dialogue. It's my pleasure to introduce Ambassador Natalie Brown. She is a champion of our health programs here in Uganda, not only from CDC, but from all of the agencies that work here. I will also say that a key priority of our mission is investing in people and supporting the health of Ugandans in partnership. So, Ambassador Brown, thank you for joining us this morning, and I'll invite you to give your remarks.
Good morning, everyone. Dr. Kambugu, Dr. Rosa, Dr. Siraj, colleagues, as Lisa said, from the Ministry of Health, from the UN family, representatives from Makerere University, friends, colleagues, people who have traveled far and wide to be here. Friends, I'm really delighted to be here with you to kick off the 2-day, 4th annual Health Innovations Conference, which aims to harness new, emerging, and capable technologies to improve access to quality healthcare in Uganda and the region. So congratulations to IDI and your flagship academy, the Academy of Health and Innovations, or just the Academy because most people know it, for sustaining this conference, even during the recent turbulent period of COVID-19 pandemic and the periodic outbreaks that continues to emerge and challenge us all. So I look around this room and I feel a little bit out of place. I'm not a healthcare professional, but I'm here because the United States government recognizes that a healthy population is the foundation for a country's stability and success. And as the largest single provider of health assistance to Uganda, the United States is committed to improving the health of all of its citizens so that they can live longer, more prosperous, better lives, and better contribute to the growth of their communities and their country. And our enduring partnership with IDI, renowned for its excellence in public health research, policy, and capacity development, has been critical to this objective, and we've accomplished so many things together already. As you heard from the IDI Executive Director, IDI receives funding from several U.S. government agencies, including the Centers for Disease Control and Prevention, which Dr. Nelson represents here in Uganda, from USAID, and these are for HIV, TB, and global health security programs. IDI also collaborates with our National Institutes of Health, or NIH, under the Ugandan Centers, African Centers of Excellence in Bioinformatics and Data-Intensive Sciences, also known as ACE. And there are only 2 ACE centers on the African continent, one here in Uganda and the other one in Mali. And just 2 months ago, I was at the ACE Students Showcase and saw some of the innovative work, such as development of a platform to track genomic epidemiology of Pseudomonas aeruginosa. I worked on that 2 months ago and again today. Machine learning-based prediction of breast cancer and the creation of an app for adolescents with epilepsy. And these are all advances that are consistent with the theme of today's conference, and it makes me and my colleagues at the U.S. Mission very proud to be associated with efforts to promote innovations to build resilient and sustainable healthcare systems. This conference is a valuable opportunity to collectively take stock of what we're innovating in our different spheres and share experiences that will ultimately improve the quality of care that can be provided in Uganda and across the region and the continent. All of us benefit daily from innovations in technology and the creative solutions which put these innovations at our fingertips. I think a great example is just the adaptation of multimedia communication tools for fast and efficient communications on health. I think, for example, look at WhatsApp. And I'm looking at WHO right now because I think every single day I receive a WhatsApp message from the WHO team on whether it's COVID or TB or certainly the most recent Ebola outbreak. And so it's amazing to see how these platforms have been used to communicate, and in some cases like leapfrog over more standard approaches. And these innovations make us more effective and more efficient, while legacy tools including email, phone calls, and face-to-face interventions like the one we're having today, they still remain important. Innovations have advanced our medical, laboratory, and public health sciences, as has been demonstrated by the in-country expertise which has been mobilized to respond to HIV, TB, malaria, COVID-19, and now the Ebola outbreak. Through continual learning and advances in science, we're now able to carry out laboratory and clinical services in the Ebola response that were previously not possible. And these innovations have also reached levels through a trained workforce and planned infrastructure. In HIV, we learned treatment was prevention. By lowering HIV viral load, we reduced transmission and improved health outcomes for people living with HIV. Additional innovations in laboratory and data sciences have put information at the fingertips of healthcare providers and public health specialists and is bringing us to the cusp of HIV epidemic control. Insecticide-treated bed nets, spraying campaigns, and now a vaccine for children is giving us hope for similar progress with malaria. And COVID-19 taught us the importance of having a resilient health workforce capable of quickly delivering life-saving services, including vaccines, to a nation. Genomic sequencing and antimicrobial resistance technologies are greatly advancing prevention, detection, and response capabilities for health security. And the most exciting thing about innovation is its continuation. While we have made great strides, we have a lot of ground to cover. There will always be new technologies emerging. Our challenge in the health sector will be to make sure we implement them appropriately for the benefit of all in our global community. Costs, for instance, present a challenge to universal access to health services, especially to vulnerable and geographically inaccessible populations who perhaps stand to benefit most from these innovations. As I know, the Academy is a major vehicle at IDI in driving collaborations in app development, artificial intelligence, health, blockchain, and drone technology. And from the ACE examples I just mentioned, it's clear you've made tremendous strides in innovation already. And I hope that over the next 2 days, you'll be able to hear more about these and other developments and even more innovations on the horizon. From the topics included in the program, data and bioinformatics, equity and inclusion, healthcare financing and sustainability, accelerating universal health coverage, innovations for global health security and climate change, and evaluating emergency technologies for resilience, I have no doubt that you will leave this conference recharged and energized to innovate and bring scale to what we have discovered works. And more pleasing is the fact that you will also be exploring frameworks for adaptation of innovations, as well as strengthening partnerships and collaborations for resilient healthcare systems. This will enable us to extend the benefits of these innovations to more people at a lower cost and at a more appropriate scale. Equity, cost savings, and prevention should be our priority. And as we explore and come up with many commendable innovations, they're not always available equally across populations due to issues with cost and access. For instance, while rapid testing allows for quicker response and improved medical services to increase survival, it's more cost-effective to prevent such health events. And on the subject of prevention, I'm so glad that we can be together in person after the 2 years of the pandemic. And it's really nice to see that we can take off our masks for a moment. Mine is on the table there. But I also just want to remind everyone, there are still COVID cases out there. COVID has been reported in Uganda. Cases are on the rise in my own country. So I implore you to get the jab, to get boosted, and encourage all of those who are important to you to do the same. And as you contemplate travel throughout this festive season, remember that the Ebola outbreak is not over until we have concluded 42 days without any new cases. So let's remain vigilant and continue to raise awareness. And as I close, I want to thank IDI for its leadership, for purposely and strategically positioning innovation on the health agenda through the Academy. Dr. Andrew mentioned Makerere University. I commend them, and I was actually privileged to attend the 100th anniversary celebrations. I recognize my United Nations colleagues and certainly the UN Capital Development Fund, and many of you present here today for supporting and embracing this annual conference on health innovation. So on behalf of the US government, and certainly my colleagues at the US Mission here in Uganda, I commit to continuing partnering with IDI to harness health innovation for a happier, healthier, and safer Uganda. Thank you.
The Health Innovations Conference is not an event as it is or might appear. It's just a culmination of what we've been doing as partners, as IDI, and we come to take account of what we're doing. So it's not just an event, but it's for everyone who is in this space, because you are doing quite a lot of work. And for us, organizing this platform is for us to have these conversations of what is our experience, what can we do better. So to have the first panel discussion, I would like to invite Dr. Ruth Obaiko, who will take us through the first session. Thank you so much.
And I am one of those people who follows the events on infectious diseases, and I must say a great job has been done over the past years, and there's been learnings that will be discussed over this session. You're all welcome, and just to open up, looking at our audience today, we have very many young people who are here to learn about resilience and sustainable health systems. I would like to ask you, Dr. Shraj, just to tell us from the perspective of WHO, what are resilient and sustainable health systems? What do they look like? If you could paint for us a picture.
Thank you. Good morning, colleagues, everyone. Uganda has had very many epidemics and outbreaks. This is not the first time we've had Ebola in Uganda. It's the 7th time, right? It's not just Ebola. We've all witnessed COVID. That's a global pandemic. But there are very many other outbreaks that occurs on a yearly basis. We've seen measles outbreak, we've seen yellow fever outbreak, we've seen Marburg outbreaks, and other acute hemorrhagic syndrome outbreaks. So all of this requires a resilient health systems. It's not just epidemic, pandemic-prone diseases. We are also vulnerable to climate change. the northeast part of the Uganda. WHO currently has a Greater Horn of Africa drought response, and it's affecting 7 countries. So, and for WHO, it's a grade 3 emergencies. So, Uganda health system is vulnerable to very many epidemic, pandemic potential diseases and climate change vulnerabilities. We've seen floods and droughts occurring at the same time. So the ability of the Ugandan health system to cope with these outbreaks without affecting morbidity, mortality, and maintaining the essential continuity of the essential health services, that is what accounts for the resilient health systems.
Thank you, Dr. Suraj. Dr. Lisa, from the CDC perspective, could you share with us what resilient and sustainable health system looks like?
Sure, thank you so much. I've been reflecting a bit since the theme of this conference is innovation, a bit about where we've been. And it has been a really remarkable 20-year journey. And I think in the early 2000s, which was around the time I began my global health career, one of the key gaps was financing. So you had the Global Fund, you had the 3x5 initiative, you had PEPFAR being founded, you had Gavi being founded, because at that time we had a lot of tools at our disposal, but they were not at scale. So antiretroviral treatment, effective interventions for malaria, for tuberculosis, many of those things, it was really about inadequate financing. So we've made great strides, but I think what we're facing now is quite different. And I think we also know that political commitment is key, right? Having governments adopt the most effective evidence-based policies. In the past, WHO would write guidelines, but it would take 5 or 10 years for those guidelines to be adopted and implemented in countries. Now we expect within months that ministries of health will adapt to the changing landscape in terms of policy adoption. But it's also about inclusion. So we need government buy-in, we need government leadership. We do need financing, and that isn't only government financing, but it's about inclusion. And so I think one of the things the COVID pandemic has revealed, much as the HIV epidemic revealed, is an issue of the need to focus on health equity and leaving no one behind. Because unfortunately, the most vulnerable individuals, whether it's HIV, whether it's COVID, people with comorbidities that might be untreated, are the ones that are going to face the consequences the most from that. I think, in terms of resilient and sustainable systems, perhaps the only other thing that I would add is that we can't be looking to the past, because as we've already heard this morning, climate change is threatening many of the gains that we've had over the last few years. But we know in countries like Uganda, it's just a matter of time before we have the next health outbreak. And so thinking about not only what has allowed us to achieve a strong health system now, but what is it going to take? And I think, honestly, outbreaks are the new normal. The United States right now is facing what we're calling a triple-demic of ongoing COVID, high rates of influenza, and also RSV among children. Hospitals are full. So I think our system has to build in a surge capacity and a resilience for the next outbreak. And I'll stop there. Thank you.
Thank you, Lisa. I think the two of you have given us a real good start to this, And it's not about a pandemic. I like what you raised, Dr. Suraj. That is not really about a pandemic. It's about, on a day-to-day, the small epidemics and outbreaks that happen on a day-to-day. But also, Lisa, you're telling us about, the issues, policy, and, how fast we respond to these, how we pull finances very quickly together to respond to issues as they arise within the health sector. Chris, I don't know, do you have a comment to make on resilience and sustainability of health systems?
Absolutely. Thank you so much. It's a pleasure to be here. Especially for our colleagues in the room or in the space of innovation. What do we refer to when we talk about resilience? The ability to survive after some difficult circumstances. And we've all been through COVID. But the ability of our healthcare system to be resilient depends on our ability to stay innovative, to continue to look for solutions that allow us to survive those tough circumstances. And so at the core of this is innovation. At the core of this is always taking risks with new ideas. I had somebody ask me, why would UNCTF be interested in drone technology? Why on earth would you do this? And the answer is, it is risky. You know, it is risky, and it's important that there is demonstration of our appetite for risk, appetite to try new things. And I think that the environment in Uganda that encourages innovation is absolutely key. I think kudos to the Ministry of Health that is very interested in, from a very early stage, on mHealth and innovations, preventing duplication so that there's alignment. And I think that's crucial to encourage innovation in this landscape and to make sure that we are a resilient healthcare system. There are struggles, but innovation is absolutely key if we're going to have a resilient system in place. Thank you so much.
Thank you, Chris. I think I love your continuous statements on taking the risk to make a change, and I think that this is where this conference is focused on. Dr. Andrew, it's a pleasure to have you. Could you kindly make a comment on resilience and sustainability?
You can see that I'm not demonstrating resilience when it comes to... Great. Good morning, everyone. This is really a great opportunity to have a conversation around resilience. And I think coming out of COVID and Ebola, resilience is the right thing to talk about because our resilience has really been tested. I want to look at this through the lens of what WHO calls the building blocks. And I want to select the information systems building block because at the Institute, we've kind of made a bet. You know, Chris said you have to take risks. And when you take a bet, you're really taking a risk because you don't know how this will turn out. So as an institute, we've made a bet on information systems, automation, digitization, and the role of data science. And I really think there are opportunities for Africa and Uganda to build more resilient information systems, especially in the context of all the rapid developments that are happening. As I mentioned in my address, I was in Kenya a few days ago. It's amazing to see how this mobile payment system called M-Pesa has permeated all aspects of life in a very positive way. And looking at the Ugandan landscape, I do think that there are opportunities that remain really unexploited in terms of building a resilient health system. For my travel to Kenya, I had to show a COVID vaccination certificate. And I was astounded that when I logged into the system, and even though I had an Infectious Diseases Institute, my data was not up to date for COVID vaccination. So I had to punch it, I had to ask somebody to do it. So it really shows that there are some low-hanging fruit that we can do with respect to information systems. And for me, I actually think that health systems, information systems are catalytic across the other building blocks. So if I was a young innovator here, I would really look at this whole thing around information systems, interoperability, because I think the gains are just astounding. If you look at the M-Pesa example, for example. Thank you very much.
Thank you, Dr. Andrew. And you know, as we're having these conversations over resilient healthcare systems, Dr. Lisa, could you kindly share with us, I know Dr. Andrew introduced you and said you're a champion for, vulnerable populations. During the COVID-19 pandemic, what could we say fell through the cracks in terms of systems? What, and I've heard of, even in the best of the economies, the vulnerable were left behind. What is your comment? What fell through the cracks during the COVID-19 pandemic, and what should we be focusing our eyes on?
Sure, thank you for that question. I think
you know, at least my lifetime, I think probably in the lifetime of anybody in this room, you know, the COVID pandemic was unprecedented because before we'd had an Ebola outbreak in a certain part of the world and the rest of the world was either watching it or maybe thinking about how they could help. But I think we were all facing many of the same issues at the same time. And on the one hand, it was invigorating to think about my colleagues at the CDC in Atlanta. They were dealing with some of the same things. How do we diagnose this disease? How do we stop it? Should we wear face masks? Should we not? What measures should we recommend? Were the same things we were discussing here in Uganda. On the other hand, I think it also highlighted that the old model of sort of the solutions being in the United States and all of the challenges being on the African continent was really not the right model. I mean, we saw a lot of innovations come out of Uganda and elsewhere. I think we saw developed countries in Europe and the United States and in the Americas really struggle with the COVID pandemic, and some of that was the key populations, vulnerable populations. I think some things in terms of where we struggled. Of course, it was the most vulnerable, whether that's the United States or places like Uganda, people who were living a long way from high quality critical care. Even in Kampala, you know, there weren't enough ambulances, there weren't enough ICU beds, but we saw the same thing in Italy, we saw the same thing in the United States. People who, again, people who had pre-existing and poorly treated comorbidities, whether it was obesity or HIV, were the ones that were most at risk. One other thing, though, that I would highlight that has been, I think, an outgrowth, unfortunately, of COVID is the dark side, if you will, of all of this information technology is a lot of misinformation and disinformation, and I think mistrust. Whether it was how things played out in COVID or now Ebola, I think unfortunately what we're seeing is some of a fraying of that trust of public institutions, whether it's ministries of health, CDC, WHO, that people are getting information in a lot of different ways, and that can be a really positive thing, but it can also mean that people are less likely to necessarily believe what their governments are telling them, what ministries are telling them, etc. I did just want to say in terms of vulnerable populations, yes, you know, they are at risk, but it's been amazing to see I think the resilience and the ingenuity. So what we saw during the COVID pandemic when there were lockdowns here for an extended period is many of the partners that we fund for HIV, like IDI, their staff, but also the community groups they work with, coming up with incredibly creative ways to get people their antiretrovirals, to use telemedicine to have follow-up appointments for patients who were on antiretroviral therapy. And even, I found out later, many of the drop-in centers that we support for HIV services for pre-exposure prophylaxis, for PrEP and ARV refills, they were some of the first ones to get the COVID vaccine into their communities, to the extent where they had local leaders in their neighborhoods asking them for the COVID vaccine. So I think while some of these communities are vulnerable, I think there's a huge untapped potential for them to actually be part of creative solutions.
Thank you, Dr. Lisa. And when you talked about untapped potential, I would like to now cast a light onto innovations. And Dr. Shuraj, if you could share with us, you know, what are those innovations that have, you know, come up through our experience with COVID-19 over the past few years?
Thank you. First and foremost, I think what the world witnessed and the time it took for a vaccine to come out. A vaccine is itself an innovation, right? It has never been that fast in the past. Be it COVID or be it Ebola, I mean, we are 90 days, less than 90 days into the Ebola outbreak, and we have 3 candidate vaccines. We do not have vaccines for Sudan Ebola virus. Similarly, when COVID came into picture, the speed at which the rapid diagnostic tests and the vaccine came out, that itself is unprecedented. We did see global supply chains disruption, and that's something to learn from and innovate around that areas. But you name it, and many countries they work around, and it was with speed.
Thank you. I like that. Chris, would you like to say something in relation to innovations? But also we know that UNCDF has been in support of doing this diagnostic impact assessment in some of the cities here in Uganda, and helping helping these cities do a rebuilding plan, conduct a rebuilding plan. And what are your experiences, and how would you relate that to the health sector?
Absolutely. Thank you so much. So UNCDF has worked with, as many of you might know, there are several new cities in Uganda. And we've looked at how can we leverage technology in governance within these new cities to more efficiently serve the citizens of these cities, to help local governments reach. Dr. Nelson talked about the scourge of misinformation. So leveraging technology to get information into the hands of different members of the population. And so we've worked with these new cities to look at e-governance strategies, allowing them to leverage technology to better serve their citizens. And how this relates is that, as we look at ways to leverage technology, it absolutely relates to healthcare. We've talked about, yes, there has been a COVID pandemic that's still ongoing. There's an Ebola outbreak, not the first, but I think when you look at the policies here of the Ugandan government in centralized communications, you have communications in various languages, and those get down to the lowest levels of society. And I think that it's important that we have technologies that allow us to do that, to get information into communities, to have the right information. If you look at policy on testing, I think the Ugandan government was also very proactive in encouraging vaccination and discouraging misinformation. But again, how do you leverage technology to make sure that that information is getting to the right people? And so I think if you look at e-governance strategies in new cities, if you look at ways that our leaders can leverage technology to better serve their citizens, it absolutely relates to delivery of healthcare. I will mention one other example, that in most rural communities in Uganda, healthcare is delivered through community health workers. I think we call them VHTs. And in many cases, leveraging technology to allow these individuals in our communities to have the right information to then pass on. Again, there is serious coordination with local governments, local healthcare leaders. And so, again, technology is at the center of all these initiatives, and being able to have the right e-governance strategies, e-governance initiatives at the local government level is important. And that's why we've done this work. Thank you so much.
Thank you, Chris. And I think we can all agree that within the last pandemic, technology really took a center stage in changing, the response and making it faster and more effective. Dr. Andrew, do you have any comments to make over, something focused on the African landscape? I know you've said many things on the opening statement, but if you could help us wrap our minds around the issue of, resilience, response to the COVID-19 pandemic, the learnings, and what, we've gathered and are running with at this current moment.
So, thanks, Ruth. I think my response will echo some of the engagements we've had as an institute in the context of COVID-19. And maybe before I go into specifics, I actually want to, because I think this is a think tank. I've come across a word that is, I think, even a notch above resilience, and it's called anti-fragility. And I'm an infectious disease specialist by training. And I get a lot of inspiration from our immune system, because our immune system is why all of us are here. So it has allowed us to thrive. So what an anti-fragile system, which I think we should aim for, is a system that improves every time it's challenged. Now let me answer your question. So we've been doing a lot of work in communities around HIV. And when COVID emerged, we rode on that system to really make sure that we optimize the response to COVID. So take, for example, the Call for Life technology, which is a technology that the Academy developed. This is an interactive voice response system. It has been deployed to support adherence to medication, HIV medication. As you know, it's not easy to take medicine every day. So when COVID emerged, our teams, to give credit to the Academy team, started thinking, how can we deploy this in the context of COVID? Contact tracing. So we had dialogue with the Ministry of Health, and this tool was piloted, especially among healthcare workers who, because of the nature of their work, are exposed. And for me, I think that's a demonstration of how you can build resilience by moving from one disease area to a broader scope of things. So I think I will cite that example. There are many other, as you know, Ruth, many other products within the Academy that, so the idea of community refill pharmacies. Can we use community pharmacies to be surveillance points for Ebola? In this country, when somebody becomes really sick, they're not going to come to see someone like me. They'll go to a drug shop. So the innovation and the resilience there is building on some of the work we've been doing to optimize those community pharmacies, so that if somebody has a bloody, has a nasal discharge that is bloody, and they go to a pharmacy, that you can pick that up at the community referral, which is already networked with some of our technology. So those are some examples that come out of the work that we've been doing. Maybe let me cite one more. I see we have partners from Broadreach. So through the work that we do in the West Nile region, we thought that we could use the data that we have in that program to do some programming and machine learning. And so we're doing some exploratory work towards retention and viral suppression. We hope we'll get some results that we can share, but you can see that we are adapting data science in a program setting and hopefully build a resilient system. Thank you.
Thank you, Dr. Andrew. And I would like to thank all our speakers for this dialogue that we've had. Really, we can all agree that COVID-19 exposed us, but we're talking about how we can respond faster, smarter, and be resilient. I would like to open the floor to our participants in case you have any question to the panelists. Martin has a microphone.
Thank you very much. I'm Ohani Giton from Wakaliro. My comment, and so would like to request if we would attract some deeper understanding, it will be okay, concerning innovation being at the center of resilience. When I look at the things which are happening in the system, I have any opinion to say. Innovation in our country is being slowed by being papers oriented. Everywhere in our systems, papers, papers, papers. Some people may have sounding papers, but they don't have innovative minds or creativity. That is the problem in our country. So I would like to request, if you really want to use innovations in order to build resilience, let us slow the issues of being papers oriented. Let us move down. There are some small people with small papers down there. They have creativity. They have innovations. Can we use them? The example is what Dr. Ano has said. I'm sure the data on COVID was being manned by people who have masters in information, but how did the data get lost? Thank you very much.
Ladies and gentlemen, the conference has started.
Dr. Lisa, you want to make a comment?
Thank you for the energy and the question. I think if by papers you mean perhaps publications, I think it's a good point. CDC at the moment is going through its own reorganization called CDC Moving Forward. And one of the things our director, Dr. Walensky, has highlighted is the need for more timely science. And also, if we have a new development, that we communicate it much more quickly and much more effectively to the public. So I thank you for that. I will say, as somebody, again, who started this process many years ago, the rate at which papers and information get published, the rate at which genomic sequences for COVID and genomic surveillance data get published is orders of magnitude faster. But I think we should think about how do we get new innovations, scientific discoveries out more publicly and more quickly.
If I can jump into this discussion, I think the other dimension to papers here, and I think it's in the Ugandan context, is formal qualifications. So I think my colleague was distraught that you might find somebody with a doctorate or whatever, but really, if you look at the hard-nosed outputs, they may be wanting. And just to say, these big tech companies like Google and whatever, they actually are not very interested in formal qualifications. They really want to see, they'll ask you to write the code and show what you can do. So I think we are inching towards that, but I think it's important to underscore that formal qualifications are important. If you came to see me as a doctor and I don't have the formal qualifications, I think you'd be uncomfortable.
Thank you, Dr. Andrew. Chris, would you like to make a comment on papers?
No, I thought maybe we'd take the question from the young lady.
Okay.
Good morning, everyone. I'm Nasozi Diana Roda. I'm a fifth-year dental surgery student. So I'm going to shift more towards dentistry because there was a recent report by WHO, and the results from the report state that half of the world's population is suffering from oral health disease. And from that report documented that the cases have increased over the past 30 years. This is a health concern. And from this field, what I can say, you find that in our setting, access to dental services is quite a challenge to me. Because you find that you only find a dentist at a health center and a dental surgeon at a regional referral or a national referral. So, and you even find that in the health center force, there are actually no dental chairs. You find some people are just, that the health professionals there are just improvising with just these normal chairs, the ones you sit on. But that's not good.
Well, I think more broadly, thank you for that question and comment, and I think sometimes there are really important public health issues that somehow aren't on our radar. In Uganda, HIV is very much on our radar, but oral health, probably not. I think there are other things where they may cause actually a really important burden in terms of morbidity and mortality, but somehow we don't see them. Road traffic accidents is a really obvious problem in Kampala, and probably not enough that's being done about it. But I would challenge you to think about then what are the innovative solutions. You alluded to different kinds of training strategies, or perhaps curative strategies, or perhaps awareness strategies, because perhaps people's dietary habits have contributed to more problems with oral health now than in the past. But this is the innovation conference, so I think I'm sure there are going to be some good solutions that come out of it.
Thank you for that very good question. I think if you look at the numbers in Uganda, we do have quite many doctors and nurses, but are the appropriate skill mix available throughout the systems? If you look at the Universal Health Coverage Index, Uganda is not doing very good. It's about 52%. So there's a need to look into the universal health coverage. There's very many indicators. Uganda can have the right mix. It is possible. There's a need to look into the right skill mix. Not everything should be curative, hospital-oriented. Now, oral health is a very good example. Uganda is good with tobacco control. It's one of the best in the Africa region. What about sugar? What are we doing on the preventive aspects? The public health messages, the brushing habits. Are we communicating enough? And are we communicating throughout? So I think there, on your question, you could apply innovation. You could have an infographic on public health messages, and you could take it around so that lay people understands how you can prevent before even you reach to the dentistry level. Of course, there's a need to build the capacity, and of course, as Lisa said, there's a need to look into the innovation. Also, looking into human resource for health, which is one of the building blocks, the continuity of medical education, or continued medical education system, and the very many steps that would be required to take forward. It would be a good practice here, and to work together with the Uganda Medical and Nursing and Dental Council to see how the public health cadres can be developed so that Uganda benefits at large. Thank you.
Thanks, Ray. I don't have a question. I have a bit of a commentary and observation, and also no field. The first one is just kind of looking around this room and seeing so many younger people here. And Lisa mentioned this a little bit in talking about some of the HIV response. Just a reminder to those of us who are perhaps a bit older that we don't have a monopoly on the solutions, that we need to listen to younger people coming up who have a new way of looking at things, who have fresher ideas. Going back to what Dr. Nelson said, like during COVID, I know one of the challenges we faced was making sure people stayed on treatment. And it was, I think in Kasese, where a young activist had an idea about getting food and resources to people. That was something that I think those of us older, more experienced perhaps, did not recognize, and it took that new vision. So for the younger people in the room, speak up. For those of us, my generation, have an open mind to listen to some of these ideas out there. I mean, that's the whole focus of innovation. The other thing that I wanted to mention is, and we're certainly seeing this right now in Uganda's response to the Ebola outbreak, and that is that a lot of the challenges and the epidemics that all of you have mentioned now, it's not just a health response. You have to, and I had the opportunity to travel with the Minister of Health to the epicenter, and seeing that it's about getting water, it's about having electricity at healthcare facilities, it's about having roads. All of these things contribute to public health, and I think when the outbreak started, people thought, oh, it's an illness, it's a disease, you have to approach it from a healthcare perspective, and it's much broader than that. So I'm glad this, innovation and hearing people talking about technology and a lot of different approaches, that's extremely important. And part of that kind of, I guess, whole of government, a more inclusive approach as well. I mentioned that means like listening to people perhaps like me. I'm not a public health care specialist, but having traveled, you see things a little bit differently, and I think the only way we're going to really make progress on this is if we have an open mind. And inclusive doesn't just mean including people who are more vulnerable, the people who use drugs, the sex care workers, the LGBTQI plus community. It means like really taking in that information from everyone. I mean, I think this kind of goes along with the comment about too many papers and having a certain mindset. And then finally, since it was mentioned, the COVID vaccine, and certainly now the vaccine candidates for Ebola, it's, we think about things in the midst of a public health crisis, but this research and the focus has to go on afterward. The reason that we had a COVID vaccine so quickly was there were other SARS outbreaks, and that research was ongoing, and they were able to build onto that. The same thing for having the Ebola vaccine candidates. there's research ongoing. I think it kind of stalled, but I think it's a good reminder to all of us, as all of you have said, like, we're going to be dealing with various epidemics for the foreseeable future, of just kind of not giving up when that immediate crisis is over and continuing to do the work. So that's kind of my appeal to everyone. Thank you.
Thank you, Ambassador, and I think that you've given us very powerful closing remarks. Unfortunately, our time is done. I would like to encourage you to interact and network during this conference, and I'm sure that you can pick up the minds of the speakers and everybody else as we move on. I think the message to the young people in the room is a problem comes first. Identify the problems within our communities and the issues that we have. Think about a solution, be innovative, and the funds to support you get through your idea will come. I would like to just ask our panelists to give us 2 priorities within our theme, building resilient and sustainable healthcare system. What are the 2 priorities, 2 priority areas that we could, throw out there to innovators to think through as we think about making our systems better? I'll start with you, Jonas. Suraj.
Thank you, Ruth. 2 priorities. I would start with what Andrew touched upon, health information system. When I came into Uganda 3 years back, there were 14 different information systems within the Ministry of Health. Now I hear there are 20, and they don't talk to each other, not all of them. And to the extent that even the district coding is not the same. So I think we do have the e-health policy that's in the draft sitting at the cabinet, but there's a need to look into the overall blueprint, the e-health architecture, and to see how these very many information systems talks to each other. So take, for example, if you have a cholera outbreak, you need to know the population around it, which are the health facilities around it. You should have the human resources who are there in the health facilities. You need to know the stock of the drugs available in the health facilities, in the epicenter as well as around it. And all of these systems should be talking to each other and not be a standalone, so that you can respond to these epidemic or pandemic potential diseases really fast. So there's a good area for innovators to look into how you can make the systems or have interoperable systems that can talk to each other. So that is one area that is very important for Uganda. Second is the innovation normally tends to skew towards digital health, but there is a need to look into the larger picture. I mentioned that the Universal Health Coverage Index for Uganda is not very good, despite Uganda having very many capable people. If you look into the first WHO Innovation Awards that was launched globally, there were 2,500 participants globally. 44 of them were from Africa, and 3 were Ugandan innovators who won the award. And one of them is here, William, who will be speaking this afternoon. So look into how you can innovate around various building blocks and see how essential healthcare services can reach the unreached at the grassroots, so that no one is left behind, and that all of you can have a part in it. So those are the 2 I would say is important for us to think into.
Thank you, Dr. Lisa.
Sure. I'll highlight 2 things. The first is for CDC, we're very passionate about lab. But if you can't diagnose a new infection, if you can't monitor patients, if you can't see new emerging issues like drug resistance or drug-resistant antimicrobial resistance, that really limits you. And I think that whether we're talking about laboratory information systems, whether we're talking about genomic surveillance, whether we're talking about multiplexed platforms to increase the efficiency of testing out in the periphery, I think lab is a really important area for innovation. The second thing is going back to the theme we started with of investing in people and workforce. Many of us were trained in a certain way, but being somebody working on health isn't just somebody with a clinical background, and we've already kind of touched on that. We saw during COVID and during Ebola that the platforms like Project Echo and Zoom, you can give people a lot of technical knowledge without bringing them together in a classroom. And so I would just encourage all of you to think about, what do we mean by health workforce? What do we mean by a capacitated and innovative health workforce? Thanks.
Thank you, Lisa. Chris?
Thank you so much. So one priority I see is absolutely financing, right? When I talked about risks earlier, if you look at the work that we're doing with IDI on drone technology to demonstrate the efficiency of this as a means to deliver emergency health materials, it's important that there is financing for these innovations to take root. If we show that this works and we can demonstrate it, it's a call to others to join in, because we need financing in this sector to grow these innovations. So that's one priority. The second is a call to my innovators in the room. It's important that your innovations are attached to viable business models. Who pays, all right? And do not be afraid to approach private sector, because they have an interest in reaching the communities that you're looking to serve with your innovations. So, viable business models, because only then can you scale the ideas that you have. So those are my two priorities that I see. Thank you.
Thank you, Chris. Dr. Andrew.
Let me continue from where Chris stopped. Show me the money, right? As an institute, I think we learned a lot about responding quickly. And it helped that we had resources from different agencies. But I think the critical lesson was around, before the big players come on board, WHO and others, you really need someone to get on the ground pretty fast with resources. So I really think, building on Chris's point, that health financing, people like me don't think about it a lot, but when push comes to shove, it really matters. But my absolute number one priority is really people-centeredness. As we innovate, and I think this is the lesson, thinking about the work at the academy, starting with people understanding the problem. And I really wanted to highlight my colleague and friend, because we trained together in medical school. Dr. Paul Nzubo, please stand up. Yes, Dr. Paul Nzubo is the leader. Please sit, Paul. He leads the West Nile Leaders Forum. So we've been working in this region for many years. But the region has organized itself. And so at the Institute, we have this capacity building pyramid where the bottom is understand the context, so that whatever you do, you're really grounded in that context. So it's been a pleasure working in this region and recognizing that we are really there to facilitate and not to really take over the work, but build with the leaders. So I think I will end on that point, that the innovation must be people-centered. Thank you.